Medication Administration Training Program. Giving eye and ear medication.
Medication can be given in the eye using drops or ointment. Please follow along in the procedure guides for giving eye drops and eye ointment as we demonstrate these procedures. First, put on gloves, since you are likely to come in contact with a child's bodily fluids when giving medication in the eye. Clean the child's eye with a clean tissue, wiping from the inner corner to the outside edge. If you need to give medication in both eyes, use a separate tissue to clean each eye. After cleaning the eye or eyes, discard your dirty gloves. Put on clean gloves. Position the child for comfort. Older children can usually sit for eye medication, but you might find it easier to have a young child lie down. If the medication is cold, rub the bottle between the palms of your hands to warm it. Match the 5 rights just before giving the medication. If you're giving medication to only one eye, be sure you're putting it in the correct eye. If the child can follow instructions, ask her to look up and keep her eye open. With one hand, make a pocket in the child's lower eyelid. Hold the medicine in your dominant hand and rest your other hand on the child's forehead to keep the medication bottle steady. Bring the medication to the child's eye, coming from the outside of where she can see. Drop the correct amount of medication in the pocket in the child's lower eyelid. Do not put medication directly on the eye, and do not touch the eye with the medicine dropper or tube. If you are giving an ointment, squeeze the ointment tube gently and apply a thin stream of ointment evenly along the inside edge of the lower eyelid. Start from the inner part of the eye, closest to the nose, and go outward towards the child's ear. Do not touch the eye with the ointment tube tip. If the second eye needs medication, remove your gloves, put on clean gloves, and repeat the procedure. The child will naturally close his eye. Ask him to keep his eye closed for a minute or 2. Wipe off any liquid that spills out of the eye. If this occurs, you do not need to give the dose again. Very often, children blink when getting eye drops or ointments. If the medication completely misses his eye, you can give the dose again. If any amount gets in the eye, don't give another dose. Replace cap on medicine and remove and discard gloves. Children will often experience blurry vision immediately after eye ointment is given. Let the child know this is normal. Be sure to check the child's medication consent form and medication label for any instructions to follow after giving the medication. Many eye medications will recommend keep child out of brightly lit room or avoid exposure to sun.
Giving ear medication.
Please follow along in the procedure guide for giving ear drops as we discuss and demonstrate this procedure. If you choose to wear gloves for this procedure, put them on. If the outer part of the child's ear has some crusting or earwax, gently remove this with a clean tissue. Never put anything directly into the child's ear canal. Many ear drops are kept in the refrigerator. Warm any cold ear drops by rolling the bottle between the palms of your hands. This is important because the cold drops may cause pain when they enter the ear canal. Have the child sit or lie down with his ear towards you. Be sure you are about to give medication in the correct ear. Match the 5 rights just before giving the medication. Draw the medication into the dropper. The dosage is usually measured in the number of drops, not a specific dosage marked on the dropper. When you're ready to give the drops, straighten the child's ear canal. The structure of a young child's ear is different from an older child. If the child is under 3, gently pull his earlobe down and back. If the child is over 3, gently pull his upper ear up and back. Place the drops so they will roll into the ear along the side of the ear canal. Be careful to not drop them directly into the ear, as this can be painful and can cause nausea or dizziness. Wipe off any excess drops on the outside of the ear. If the drops completely miss the ear, give the drops again. If any portion of the drops get into the ear, do not give this dose again. Have the child stay on her side for a few minutes if possible. Hold an infant in the same position for a few minutes so the ear drops will not flow out of his or her ear. If drops are needed in the other ear, repeat this process. If you wear gloves, remove and discard.